歡迎大家出席今日嘅。
Welcome to the press briefing. We have today Dr. Albert Au, Principal Medical and Health Officer, Communicable Service Disease Branch, Center for Health Protection, and Dr. Lau Ka-hin, Chief Manager, Hospital Authority. The two doctors will give you an update on the Hospital Authority and the number of new confirmed cases. Dr. Lau first. Good afternoon. First, about the Hospital Authority. We have 2,739 confirmed patients staying in hospitals. Of those, 396 are newly confirmed cases. There are 1,561 patients in isolation facilities. Of those, 542 are in isolation wards, 161 are in second-tier isolation wards, 631 are in the North Lantau Hospital Hong Kong Infection Control Center. 227 patients are in the AWE COVID-19 Treatment Center. In total, 274 patients are newly admitted patients. Yesterday, 16 patients reported to be critical and 14 in serious condition. And of the confirmed patients in hospital, 61 are in critical condition, 51 are in serious condition. Of some of the 16 critical patients are receiving intensive care. For fatality cases, 6 cases are reported, 3 males and 3 females aged between 77 and 94. 3 of the deceased patients have not completed 3 doses of vaccine. 2 of them did not even have the first dose of vaccine. Now I'll give you some information about these deceased patients. 77-year-old male. He had diabetes, hypertension, hyperlipidemia. On the 16th of August, at the community testing station, he did a test. The result was positive, CT value 20.86, and then his family members reported his positive result to the Department of Health platform. And then on the 18th of August, we called the patient. The patient's daughter took the call. We were told that the patient had some minor coughing and runny nose. There was no fever and no shortness of breath, and his appetite was normal. We suggested that the patient went to either a designated clinic or sought teleconsultation to receive oral COVID medication, but then the patient's daughter didn't think it was necessary because the condition of the patient was mild, and then we taught the patient's daughter what to do and to observe for signs of worsening of the patient's condition, such as shortness of breath, fever, and so on. And if so, then the patient must be sent to the accident and emergency department. And then after that, the patient's appetite became worse. And then starting from the 1st of September, he started to have problems walking properly. And then in the early morning of the 1st of September, family members found that the patient was unconscious, so they called ambulance. And then when the patient arrived at the accident emergency ward, he had no heartbeat, so there was resuscitation. And so at the A&E department, they tried to resuscitate him, but it didn't work, and that patient passed away that morning. Now, that patient had 2 doses of vaccine. After the PCR test result was reported to the Department of Health. Now, I would like to make an appeal to the public, especially for the elderly aged 60 or above. Now, very often the patient or the family members might think that, well, the condition is mild and the patient is doing fine. In that case, we may refer the patient to either our designated clinic or teleconsultation. And even when we made the suggestion, the patient or family member might not take it up, or even if they do seek consultation, they may not take the oral medication. But for patients aged 60 or above with no symptoms or mild symptoms, they need to take the COVID-19 oral medication to prevent their condition from worsening or from the need of hospitalization or even from death. So for members of the public, if you have elderly family members, please, if they contract COVID-19, please make sure they seek medical consultation, or they could make telephone booking for teleconsultation. For the remaining 5 patients, 2 in 2 cases, the death was not related to COVID. An 89-year-old male with some chronic diseases, he passed away because of hemorrhage in the brain and also multiple organ failure. He did not have any vaccination. An 88-year-old female, she had 2 doses of vaccine. She passed away because of cardiac disease and also she had pneumonia. For the other 3 patients, their death was related to COVID-19. A 90-year-old male, 83-year-old female, 94-year-old male. Now they all had chronic diseases such as diabetes, hypertension, stroke, history of stroke, dementia, or atrial fibrillation, or ventricular fibrillation. Now, in the past day, 318 patients recovered, 282 patients were discharged, and 7 patients tested positive upon hospital admission or when they're in the ward. 9 in the same ward are listed as close contact. 151 staff members are new confirmed cases. 40 staff members have returned to work. And now an announcement involving the medicine ward of the Queen Elizabeth Hospital. At the medicine ward of the QE Hospital, 4 patients aged 62 to 93 became confirmed cases. The 4 patients were in the same cubicle as another patient who tested positive earlier at the Cowland Hospital. For the 4 patients, they're now receiving treatment in isolation. 3 are in stable condition. 1 is in critical condition. The critical patient is 93-year-old male. He has other illnesses. The hospital is now trying to investigate into the link among the cases. For the particular ward, visiting has stopped, and also there will be disinfection, and the hospital will closely monitor the health situation of staff members and ward patients. They will also keep in close liaison with the Department of Health to follow up on the latest situation. United Christian Hospital Accident and Emergency Department. That's some information about a nurse working there. At the United Christian Hospital, a nurse at the Accident and Emergency Department tested positive by rapid antigen test yesterday. So she's now confirmed a COVID-19 patient. The hospital immediately started contact tracing. They found that this colleague attended the wedding banquet of another colleague in the same department. So for 6 A&E department nurses in the same table with her are now listed as a close contact. The operation of the A&E department is not affected. The hospital authority will closely monitor the condition of their staff, and they will keep in liaison with the Department of Health. Thank you. That's all from me.
Thank you, Dr. Lau. I will now report on the COVID cases reported on the 2nd of September. Yesterday, there were a total of 10,222 local COVID cases, including 3,051 PCR positive cases and 7,171 RAT positive cases. Some of them were verified through PCR tests. Yesterday, there were 204 imported cases. 181 were picked up through PCR tests. 23 were RAT positive cases. For death cases, there were 7 additional fatalities. Altogether, up to now, in the fifth wave, we've recorded 9,503 death cases, apart from the cases, the 6 mentioned by Dr. Lau Kai-hin, reported through the hospitals. Yesterday, we received cases from the forensic pathologist. It's a case who passed away at home. It's a 69-year-old male. On August 28th, he was found unconscious at home and passed away. He had no vaccination. He lived alone. So far, we know that he had no chronic illnesses or no known chronic illnesses. Based on information from his family, on August 21st, he had shortness of breath, and then he had diarrhea, fatigue, and a sore throat. But he did not seek medical attention. He did not get tested. His relatives visited him on August 28th and found him unconscious. The ambulance officers arrived and then found that he passed away. Subsequent pathological investigations suggest that for both RT and PCR tests, he tested positive. I would like to make an appeal here. If you develop symptoms, seek medical attention and get tested, especially for seniors. In the community, COVID is still prevalent. If you develop acute symptoms, you may have contracted COVID. Early diagnosis is key here, and early treatment is also key to prevent the infection from developing into serious illness. If you have relatives who live alone, reach out to them and encourage them to get tested. Now, for imported cases recorded yesterday, there were a total of 204 imported cases. 65 cases were found at the airport test specimen collection center. 61 cases were found at quarantine hotels or quarantine centers. 78 cases were found at community testing centers, including 71 cases were found between day 4 and day 7. As for the rest, 7 cases were found after day 7. For these 7 cases, they had high CD values. These are possibly repositive cases. Now, for the countries from which we had the imported cases, they involved 44 countries. 4 of them each contributed more than 10 cases, including the UK, 33 cases, Thailand, 24 cases, US, 21 cases, and the Philippines, 19 cases. As for the rest, more than 40 cases, each of them contributed fewer than 10 cases. For care homes, 10 care homes reported infections, including 9 elderly care homes involving a total of 10 residents and 2 workers. 1 care home for persons without disability, 1 resident caught COVID. For the 10 care homes, 69 residents were classified as close contacts and need to go into quarantine. That includes a care facility in Yunlong, Christian called Shanghai Wulei Yun. 1 resident tested positive. A care facility in Kuntong called Suijun Wulu Zhongshan. Another care home in Yaotong. And then in the North District, Tonghua Group of Hospitals, Pochong Chunying Care Home, 1 resident tested positive. And a care home in Yunlong Salvation Army Canteen Home for the Aged, 2 residents tested positive. In the Northern District, called Songdang Yun, there is a resident who tested positive. In Kowloon City, Kongda Wulei Zhongshan, and then there's another care home in Tokwa Wan where a resident caught COVID. In Shatin, there's a care home, a resident tested positive. In Shatin, another care home called Gayi Wuliang Yun, 1 resident and 2 workers tested positive. In Kowloon City, called Onga Wulo Jiga, 1 resident tested positive. And then for the care home for the persons with disability, it's a care home in Tuen Mun called Jinleung Geilang Fa Jin Zhongshan, the boarding section where a resident tested positive. Over the past 7 days, 22 care homes reported infections, including 37 elderly care homes and 15 care homes for persons with disability. 89 people have been involved, including 39 residents and 16 involving workers. It's a school holiday today. No additional infections are reported. Yesterday afternoon, we received reports involving 3 schools where individual classes saw some clusters of cases. We recommend the relevant classes to suspend face-to-face learning. The first one is a school in Shatin called Jockey Club, called in class 6A, 15 people. There are 15 students. 3 cases are reported. For the 3 cases, these are students in the same class. 12 of them attended a party on August 30th. Investigation suggests that 9 people have tested negative so far, but they are classified as close contacts and need to undergo home quarantine. The second school in Wong Tai Sin called Sim Lim Dak Xu Yun, it's also in class 6A. There are 30 students in the class. 4 students tested positive. We recommend class suspension for this class. And then the third school is a school in Yuen Long called York Montessori School. There are 2 classes involved, PN Yellow, AM class. There are 20 students in the class. 1 student and 1 teacher tested positive. At another class, PN Tiger, it's an afternoon class. There are 15 students in total. 1 student tested positive along with the teacher. Now for the mutant strains, the Public Lab Services branch tested some specimens, and we found it for L452R suspected BA.4, BA.5 cases. The proportion has risen to 3.1%, which is higher than the 60.3% previously reported. For L452R specimens, roughly 88% of BA.5 cases and 12% of BA.4 cases. In other words, BA.5 cases make up 55.5% of all cases. And for BA.4 cases, they make up 7.5 cases. For BA.2, 12.1 cases, the level remained stable at 5.6%. As for BA.2.2, it stood at 31.3%. We would like to remind the public that we have noticed it's time for some people to get their next shot, but they are hesitating, wondering whether they should get the next generation vaccines. We would like to appeal to the people that if they haven't been vaccinated or the time has come for them to get the next shot, there's no need for them to wait for the next generation of vaccines. They should complete the vaccination course as soon as possible, so that as to minimize the risk of hospitalization, severe illness, or deaths upon infection. For local cases, there is a risk for local cases to remain at a high level or rise further. So for those who haven't completed their vaccination course, they should get all their shots to protect themselves. There is also an abundance of local scientific data suggesting that our existing vaccines, including the Sinovac and the BioNTech vaccine, they are highly effective in protecting against severe illness and deaths. Vaccination creates neutralizing antibodies, and it can also trigger the T cells in the lymph system to create long-lasting anti-immunity. And the current level of T cell protection can create memory immunity, which can protect against different variants, including Omicron. Now, for elderly and young children, the vaccination remains on the low side. For those aged 3 to 11, 33.5% of children are either unvaccinated or have had only 1 jab. For the elderly, for those aged over 80, 32.7% of them haven't had a jab or have only 1 jab. If you haven't been jabbed, for those aged over 80, if they do catch COVID, the fatality rate can reach as high as 14.88%. For those triple jabbed, the rate goes down to 1%. For those with 4 jabs, the rate goes down to 0.33%. So we urge people to get vaccinated or complete the vaccination course as soon as possible. The floor is now open to questions. Please put up your hand. Our staff will pass you the microphone. Before putting your questions, please identify your media outlet.
To the right, the second last row, the gentleman there. I'm from Cable TV. Good afternoon. For one of the fidelity case, now on the 16th of August, he tested positive at a community testing station, and the Department of Health informed him on the 18th of August. So does it mean that there's now delay in notifying patients? Now, for confirmed patients, how long do they have to wait before they receive notification from the Department of Health, and then for arrangement to be made to send them to hospital? Now, government expert advisor said that this wave of epidemics is expected to peak in the middle of this month, but what is your assessment? And then Professor David Hui also suggested turning the quarantine arrangement from 0 to +7 instead of 3 + 4. Now, Dr. Au, you caught COVID yourself, so how did you feel? And what was the arrangement regarding the Department of Health? You've asked more than 10 questions. Please, can you ask the other question? Ask the two doctors to answer your questions, please. On PCR test, if people go to the community testing center to take the PCR test, usually over 90% of those will receive an SMS message within 24 hours informing them if the result is positive or negative. So after people take the PCR test, they should look out for an SMS message on their phone. And then when they take the test and make sure they provide the correct phone number. Otherwise, they may not receive the SMS notification. And when people receive the notification, then they could report their case online to us. And they could provide information about their own case, the date of the positive test result, and their household condition. And then we arrange for the patient to be isolated at a suitable location. Well, it could be home isolation, or if necessary, the patient may be sent to community isolation facilities. And after a member of the public has declared his positive test result, the information will also be sent to the system of the hospital authority. And then the hospital authority colleagues could immediately approach the patient to find out about his or her condition. And then when the testing station test result is out, we will also receive the information simultaneously. And if members of the public have not received the information, we will contact them and find out about the situation, or remind them to declare the case and so on. Now, as to when this wave of epidemic may peak, we respect views expressed by experts. Our view is that the epidemic is still on an there's still an upward trend. And then in the past week, we could see that there is a constant increase in the number of daily cases. And then from, say, other indicators such as sewage surveillance, we could see the average rate of viral load in sewage is over 500,000 per liter. And then we don't see the situation peaking yet. We think that there is still an upward trend. As to when it will actually peak, we cannot really say for sure. Of course, we don't want to see the epidemic worsening further. We would like to remind the public to follow all the prevention and control measures, and also take regular tests, especially if you have symptoms. And if you test positive, you should declare your cases and then go into isolation. We want to try to keep the numbers down so that we won't undermine the public healthcare system. Now, I didn't make myself clear, perhaps. Well, it's not the Department of Health that would call the patient, but rather us. The patient did a test on the 16th of August. He probably received the test result on the 17th of August. And then on the 18th of August, he declared his test result to the Department of Health online platform. So if you have a PCR positive test, you should go to the declaration platform for PCR. And if you have a RAT positive result, then you go to the RAT platform. Anyway, we call the patient on the 18th of August. That's the hospital authority. And the person who took the call was the patient's daughter. And then we explained to the daughter on the possible arrangement. And then the daughter thought it was not necessary for the patient to go to a designated clinic or whatever. So we would like to make an appeal to the public. Now, usually we'll call patients who are age 60 or above. In particular, those age 70 above, we will call them even sooner. But then for patients age 60 above, we would like to call them more too. But then our observation is that for some patients, when we call them, they don't pick up. So we can't reach them, and so we're not able to pass on useful information to them, or help them make bookings with at designated clinics or teleconsultation sessions. And like in this case, when we call the patient, we're told that there's no need to see the doctor or take medication. And we would try to convince the patient to see a doctor and take medication even if there are no symptoms. But then if the patient refuses to do so, there's no way we could force the patient to make a booking, because then he may not show up, and so the slot could have been given to someone else. So even if a person has had 3 doses of vaccine, and even if there are no symptoms, if they're age 60 or above, they should see a doctor as soon as possible once they test positive. Next, please. Good afternoon, I'm from Now TV. If I could follow up on what Dr. Au said, well, you tested positive. We're all very concerned. Did you have any symptoms? How did you contract the disease? Had to do with your work? And would affect your team's work? Are there any other colleagues on the team listed as close contact? Second question: the 70-year-old plus male patient. Well, Dr. Tony Ko said that the hospital authority may make over several thousand calls, but only 40% of the elderly patients would agree to take medication. So how many calls can you make a day, or do you just try to make as many calls as possible? And are there any measures to help patients who may have some wrong ideas about medication? Would you offer them help at at home? And then for PA.4 and PA.5, what do you think the ratio of the two is going up too high, and is it higher than what experts expect? Before Mid-Autumn Festival, do you need to tighten social distancing measures? You have also asked more than 10 questions. Please allow the 2 doctors to answer your questions. First, I would like to thank friends of media for your concern. This is a press briefing on the update of cases, so it's not really appropriate for me to answer questions about my own case. Now, for BA.4 and 5, in the past few weeks, we could see that for L452R, the ratio is going up steadily. So with this rising trend, we expect there will be more cases. And then among the L452R, about 90% of the cases are BA.5 variant strain. So the BA.5 is now the prevalent Omicron strain in Hong Kong, and we expect a number of cases to go up further. From the latest information of the World Health Organization, BA.5 now accounts for 78.2% of all cases. We expect that to be the case in Hong Kong too. BA.5 will probably take over, will probably, face out other Omicron strains. For BA.5, is more transmissible than other strains. So we expect that because BA.5 will become the prevalent strain in Hong Kong, so that we will be seeing more community transmission cases. That means there will be more confirmed cases. But then scientific evidence also shows that after someone contracts a BA.5, in terms of a serious or fatal condition, the risk remains the same as other strains. Also, there are now effective measures in place to prevent BA.5 infection.
Outbound calls we're making every day. We make 3,000 or 4,000 outbound calls every day for those aged below 5 years old or older than 60 years old. The third category of people we make outbound calls to: those suffering from conditions linked to them being in an immunocompromised position. We check with them how they're doing, we explain things to them, and see whether there's a need for us to help them book a slot for teleconsultation or a slot at designated COVID clinic so that they can have early access to the oral antivirals to prevent the worsening of their condition or hospitalization or deaths. Next question, the left journalist at the second last row. Sorry, what's your media outlet? I'm from TVB. For young children who are hospitalized due to COVID, there's a sharp increase in such cases. It has doubled compared to the level from last early last month, you see there's a likelihood that such trend will continue. Now, how many such cases are there? And what's the occupancy rate for the pediatric isolation facilities? Are you concerned about the situation of such facilities, and what will be done about it? Now, for the hospital authority, for those aged 0 to 11 years old, there are 144 such patients. Some of them have recovered. Others are still receiving treatment at isolation facilities. Now, for isolation facilities, the occupancy rate is at 70%. As I said yesterday, you cannot have the rate go up to 100%. At 70 or 80%, that's the upper limit of such facilities. We will try to activate more beds, especially at pediatric wards. If there's no space at the pediatric ward, we will activate more beds at adult wards. We will modify the barriers and bring in suitable beds for children. We try to maintain a family-friendly practice. That means there may be family members who would like to accompany their children. We will try to facilitate things, but to make that happen, you need the right kind of facilities, and changes need to be made to the layout of the wards. And we have thought about these things for young children and seniors. If they are unvaccinated, a higher ratio percentage of them will need hospitalization. So we have to prepare the beds accordingly. We hope that the beds will never be put to use, but there is an increase in the hospitalization level for children who have caught COVID. We have paid greater attention to such cases. If children have developed croup, they should seek medical attention. The same if they have high fever. For parents, if they notice something wrong with their children, they should take their children to a doctor and to receive early treatment. There are 3 patients in a serious or critical condition. As I announced earlier, there is at the United Christian Hospital, the 15-month-old infant girl. She was in a critical condition. She's now in a serious condition. That means she's doing better now. Over the past 24 hours, her convulsions have stopped. As for the magnetic resonance imaging results of her brain, things are normal. Based on the Glasgow Coma Index, she's at 13. Fever has subsided. So the doctor has classified her condition as serious rather than critical, which is an improvement. Now, for the 17-month-old boy that we mentioned at Princess Margaret Hospital, he's still in a serious condition, but he can breathe on his own and no longer requires a ventilator. His vital signs are stable. At Truman Hospital, there's a 5-year-old girl and 9-month-old girl. She's still in the pediatric ICU. The last thing we want to see is patients in a serious or critical condition. For children and their family, not only adults can bring their children to a vaccination center. Parents should bring their children 6 months old or older to get vaccinated. For pediatric groups and different doctors groups issued guidelines saying that vaccination can help prevent severe illnesses. It can be something as simple as high fever, twitch, convulsions, croup, or necrotizing encephalitis, or multi-system inflammatory syndrome, or long COVID. The benefits of vaccination far outweigh not getting vaccinated. Do not hesitate anymore. You never know when the child is going to catch COVID. We may have caught COVID and then brought the virus home to the children. Given the virus is everywhere, we may get infected ourselves if we infect the children, they are at greater risk if they are unvaccinated. That's why from different media and different people in the community, they're asking people to take their children to get them vaccinated. The repetition of the message alone may not be good enough. We don't want to have to use serious or critical cases every time to convince people to get their children vaccinated. But evidence suggests that vaccination can help avoid such situations. Vaccination can help reduce risk of hospitalization. With lower hospitalization levels, that will mean less pressure on the hospital system. We will need to activate fewer wards for patients, for pediatric wards, apart from the layout, the modification to make them more family-friendly. In terms of the manpower deployment, we have also made arrangements. In this way, we have arranged healthcare workers to undergo suitable training for duties in pediatric wards, so that when child patients are received, the workers can help care for them. But they're not as good as designated pediatric wards, but at least the workers will have some knowledge in terms of how to care for children. Next question on the left to lady at the back. I'm from Main-Pao. This morning, Dr. Tony Ko said that only 40 people, the seniors contacted by the hospital authority, were willing to take oral antivirals. But why are the rest of them reluctant to take oral antivirals? How many said they refused to seek medical attention after the call? And how many refused to take medication even after seeking medical attention? For PCR and RT positive cases, do they have to declare the infection online before the CHP will know whether the patient is over 60 years old, and then the information gets passed to the hospital authority? For the 77-year-old death case, this person got a call only 2 days after testing positive, but the guideline says that the oral antivirals work best within 5 days of infection. Is there room for improvement in how quickly such outbound calls are made? After there are only 3,000 to 4,000 calls are made every day. There are some red coat holders, 4 of them, entered restricted premises. The police said that based on the information, they took action and escorted them to Penny's Bay. So how did you know these red coat holders entered the premises? Was it because the Leave Home Safe app? This morning it was said that for COVID patients and for non-COVID patients, hospitalization levels have increased for both categories. Compared to the peak of the 5th wave, are we seeing fewer non-COVID patients seeking medical attention? Why is that the case? Before the resurgence, the hospital bed redeployment plan draft formulated by HA, did you anticipate these developments? Can you just let the doctors respond to the questions? I'll take the question first. For declaration of infections, there are 2 tests, PCR tests being the first of them. These tests are done at hospital authority or community testing centers. For those who test positive, they have submitted their name and Hong Kong ID card number and a phone number. For these positive cases, the laboratory is involved. We will submit the information to the Department of Health. Once we receive the information, we pass on the information to the hospital authority. Once we have the full name, the phone number, and the date of the specimen, and the relevant information, the information goes to the hospital authority. Once people receive the SMS message, they should make use of our online platform www.dh.gov.hk/CTPI. Once they declare the infection, we will receive further information such as the people's address and information on their symptoms, so that the HA will have more information to work with in terms of how people are doing. The second category, RT cases, we rely on people to declare the infections. People may do RTs at home. If they do not declare their positive results, we wouldn't be aware of their positive result. For those who test RAT positive, they should declare the result online on www.dh.gov.hk/RATP. After they declare the result online and we receive the information, the people have to upload the image of their Hong Kong ID card and a picture of the test result, and then they complete the declaration. The information goes to the hospital authority. The HA will send an SMS message to the patient. The patient can contact the HA, or the HA will also contact the high-risk patient. The second question, the holders of the Amber Code. The government takes targeted measures. For those at the highest risk, they can be managed so that most people in the community can resume normal lives, and we focus on managing those at the highest risk, including confirmed COVID patients. After the confirmed patients declare the results or they test positive, their information is transferred to the OGCIO's website system. After the matching is done on the platform, the persons involved will see their vaccine pass turn red. After people test positive, they should stay at their place of isolation. For those undergoing home isolation, they should not leave their home. Over the past week, we remained in touch with our OGCIO colleagues. When a person enters a restaurant, they have to scan their vaccine pass. If someone is found to have an Amber Code and the OGCIO becomes aware of this, the OGCIO will provide the information of this person to us. So we will investigate the case and see if someone has breached the conditions of the isolation order. And if there is evidence or if we have suspicions, we work with the police in enforcing the law.
Well, each day we make 3,000 to 4,000 calls, and that do not include calls that we receive. So we call 3,000 to 4,000, make 3,000 to 4,000 calls a day. At the same time, we receive about 700 to 800 calls a day. Now, where people may call 1-836-115, and people we keep receiving calls on that line to make inquiries about medical issues. So in total, we handle about 5,000 calls. We keep increasing staff members to do the calls, including our own staff, part-time staff, and contract staff. We also in discussion with private medical care institutions to see if they would help us to make calls. Well, you may have recorded a press release from the Gleneagles Hospital. They are now helping us to make calls too. So the target are patients aged 60 or above, or patients under the age of 5, or chronically ill patients who are immunocompromised. For patients aged 70 or above, we will make the calls the same day, almost. Now, for that patient, he uploaded his information on the 18th of August. We called him on the same day. So we'll watch the situation, and then we will go by cases with different levels of risk. For those who are high risk, we'll call them sooner. In any case, we hope to make the call within a day or two. Now, you say 40% of the patients refuse to take medication. Well, perhaps you could ask your own family members or relatives if they contract COVID, would they take the medication? Perhaps your family members will tell them, no, I won't take the medication. Well, why? There are many reasons. You know, Chinese people, like the patient I mentioned, he felt that his symptoms were mild, so he wouldn't take the medication, or he was worried that, Western drugs are too powerful. So I would rather go for Chinese medicine. So many people in Hong Kong have such sort of mindset. So I hope people will appreciate this. First, over tens of thousands of patients in Hong Kong have been administered with the drug, and we do not see any serious side effects so far. So the drugs are relatively safe. And then before the drugs are prescribed to you by the doctors will ask about your condition and whether there are any contraindications, so you can't really take the medication. So doctors will first assess the situation before prescribing the suitable COVID medication for you. Thirdly, most importantly, for all the literature available, it shows that after people take the COVID medication, it will reduce the chance of hospitalization and, in particular, fatality. Is effective by as much as 80%. So if something could lower your risk by 80%, I'm sure you would go for it. So if we call you, and then we ask you to make bookings, you need to make bookings, and to see a doctor. And if the doctor prescribes medicine to you, please take the medication. And after you take the medication home, please take the medication as instructed. Because we've heard cases that people may, take the medication home, but they keep it till the condition worsens. But as the reporter friend just said, it's best to take the medication within 5 days. Of course, the earlier you take the drug, the better, but within the 5 days you take the drug, it works better. So don't keep the drug and wait till later, just because you want to save it for later. But you should really take the medication in the first 5 days, and then you have to complete the whole course, and you have to take the medication twice a day as instructed. For COVID and non-COVID patients, while we are seeing increasing number of COVID patients being hospitalized, we announce the figures every day, as you know. For non-COVID patients, well, that's why did Dr. Koh say that? Because in past few waves, when COVID was at its peak, for other non-COVID patients who had other conditions, they may not go to the hospital for treatment at once. They would rather wait. For this particular wave of epidemic, now we are seeing an increase in the number of COVID patients, but then we're not seeing the same reduction in the number of non-COVID patients as in previous waves. So that means the hospital authority is under heavier pressure. We have to make sure we have enough beds for COVID patients and as well as for non-COVID patients. Of course, we need to take care of COVID patients, but at the same time, if there are not fewer non-COVID patients, that means our colleagues have to work harder, and there will be increasing pressure on the healthcare system. So what can we all do? For non-COVID patients, they do need to see a doctor for their own condition. They may have cancer or other emergency condition. For emergency condition, of course, we can't ask non-COVID patients to wait. So it's about reducing the number of COVID patients. We need to observe all the prevention control measures, wear a mask, avoid going to crowded places, don't go to banquets, don't go to places where you have to take off your mask, and of course you need to get vaccinated. As Dr. Ao already quoted some figures, so you know how vaccination could reduce the fatality rate and so on. And then, of course, if you contract the disease, you should take a medication, and that will reduce the need for hospitalization, and of course, that will lessen the pressure on the healthcare system. And then for non-COVID patients, they will be not affected as much, and their condition may not worsen because they can't get treatment.
Just then I made a mistake with the website. We have two platforms, one for those for PCR results. If you get a PCR test result and test positive after visiting a community testing center, you declare that on the PCR platform. The website is www.chp.gov.hk/CDPI. Now for those who test RT positive, they should go to the relevant platform. They have to upload an image of their HK ID card and the test. www.chp.gov.hk/RATP. After they declare their results for the first time, they will get an SMS text message for those who have done an RT test. They have to click on the link and upload an image of their Hong Kong ID card and the test kit. That completes the declaration procedure, and then they will get the isolation order. Next question on the right, the gentleman over there. I'm from Hong Kong 01. For the 77-year-old male who passed away, did his family members make the decision about not seeking medical attention? Are we seeing these cases often where someone didn't visit a doctor because of a family member's decision? What are the motives behind that? What are the reasons? If the patient wants to go to seek medical attention, what can be done? Dr. Tony Cole said 3,000 hospital beds will be set aside, but given the rise in the cases, how much will the 3,000 beds be of use? Now, that's a hard question you have posed. We call the 77-year-old male, his daughter picked up. We get information from his daughter. Now, if the family members decide not for the patient not to seek medical attention, we respect the decision. That's why we repeatedly state this. That for the 77-year-old male, if he felt there was a need to visit a doctor, and if he told his family members, and the family members would make the arrangements. But if we call the family members, we may tell the family members about the designated COVID clinics. The arrangements are easy. There are taxis available. They can also choose teleconsultation. There will also be home delivery of the oral antivirals. The drugs will be available in a couple of days. This is something people need to be aware of. That's why we stress this message about taking medication as a way to lower the risk of severe illness and death and reducing the pressure on the healthcare systems. Now, as for what Dr. Tony Cole said, that's about the number of hospital beds in phase 3 of the deployment plan. We're talking about 2,500 or to 3,000 beds. We have activated 2,000 or so, close to 3,000 beds. We now have 2,700 odd patients being hospitalized. There are more than 1,500 at isolation facilities. Others are staying elsewhere, Tier 3 wards, for example. These are recovering patients who are no longer infectious, or those found to be COVID positive upon hospital admission. We keep an eye on the situation. If there are more people requiring hospitalization, we will convert more wards into wards for COVID patients. At the Asia World Expo, there are 240 beds. We have the manpower for 200 beds, and then we also have contractors and also getting our workers to work together. Let's all work together to lower the infection numbers. And we'll take the last question from the lady. I'm from In Media. For the nurse at United Christian Hospital, the nurse who attended the wedding banquet, how many people attended the wedding banquet? Has anyone been found to be in breach of the COVID rules? Are there health workers from other hospitals involved? I don't have specific information on this, but I would like to make 2 points. We let our workers know that they should avoid crowded gatherings, avoid mask-off activities. Many of our colleagues are aware of this, and they can keep it, and we hope they can keep up on this. Our workers do daily rapid antigen tests. If they get infected or their family members get infected, they will be aware of this early on. Some workers in certain wards, in cancer ward or hematology ward, or those on outreach teams, they have to do 2 and in the days to come 3 PCR tests per week, so that we can find out early if they catch COVID. This is done to lower the risk of them passing on the virus to colleagues or other patients. That concludes the press briefing today. Thank you. I could take the question. As we said, if we have sufficient information, including the name, the phone number, the Hong Kong ID number, the specimen date, and the age, the information is sent to the HA automatically. Speaker is not using a microphone. Now for the CHP, once the CHP gives us the full information, we will start making the outbound calls because we want to get hold of the patients as early as possible so that we can book slots for them and give them medication.